Good morning. So today we're going to do some nail surgery with a patient who has a painful ingrown toenail. And I thought it'd just be an opportunity to talk to you about what happens if you have an ingrown toenail and you have to come and see us. Well, with an ingrown toenail, it's basically a splinter of your toenail that's embedded into your toe, causing pain, swelling, and often infection. And now, if you have a splinter in your finger, a piece of wood or a thorn or something, then you're going to want to remove that splinter because it's painful and it's swollen, and that's the only way you're going to take the pain away. You wouldn't go and get antibiotics to and hope that it go away. If you leave it, you need to take the splinter out. And it's the same with your toe. We need to remove that painful splinter so it stops digging into your toe, causing pain. Now, if it's superficial, then often we can remove that splinter just conservatively using some fine clippers and a file, maybe a scalpel, and that's not painful, and you'll get immediate relief. But oftentimes the splinter's too deeply embedded, and so the first thing we're going to do is we're going to give you a local anesthetic injection, which will immediately take the pain away so you don't feel any pain during the procedure, just like going to the dentist. And once that's done, we can all relax. We can remove the splinter using sterile instruments, as you would expect. And then, since we don't want that splinter to grow back, it often will, we'll put a chemical called phenol on that part of the nail bed that's been causing problems, and that will stop that part of the nail from growing back. You won't lose your whole nail, just that section that's been causing trouble. Now that creates a wound that takes a few weeks to heal. We give you a dressing pack, and you have to change the dressing every day until the wound dries out, much like any other wound you might sustain in another surgical procedure. But it's fairly straightforward, and there aren't usually any complications with it. And most of the time, the nail doesn't grow back. We're talking about a 95% success rate with this procedure. So it's a very satisfying thing to do with very good outcomes. So there's nothing to worry about. And that's how we deal with an ingrown toenail. We do it all the time, and it's very straightforward for us. And we obviously want to make sure that you're comfortable and have a stress-free experience. But at the end of the day, you're going to walk away without that ingrown toenail, and your toe will heal normally over time. So hope that's helpful. If you're struggling with an ingrown toenail, don't hang around with it. Don't keep going to your GP getting antibiotics. You wouldn't do that with a splinter in your finger, would you? You'd remove it, and that's what we need to do with an ingrown toenail. So come and see the specialists, and we'll be able to help you out. Okay, hope that's helpful, and I'll talk to you again soon. Bye.